Female reproductive anatomy. What's normal and what's not? Have you ever wondered what makes up the female reproductive system? It is a fascinating and complex structure designed for reproduction, hormone production, and sexual function. Let's break it down. The female reproductive system consists of both internal and external organs. The main internal organs include the ovaries, fallopian tubes, uterus, cervix, and vagina. The external parts, known as the vulva, include the mons pubis, labia majora, labia minora, clitoris, and vaginal opening. Each of these components plays a vital role in the reproductive process. Normal variations in female anatomy are quite common. For instance, the size, shape, and color of the labia can differ significantly from person to person. The prominence of the mons pubis can change based on estrogen levels. The clitoris, which is essential for sexual pleasure, also varies in size and shape. The hymen, a thin membrane located near the vaginal opening, can take on many forms. It is important to note that the appearance of the hymen is not a reliable indicator of sexual activity. These variations are influenced by genetics, hormonal levels, age, and life stages, such as puberty and menopause. The uterus is made up of 3 layers. The outer layer is called the perimetrium, the middle layer is the muscular myometrium, and the inner layer is the endometrium. The endometrium thickens and sheds during the menstrual cycle, which is a normal part of female reproductive health. Ovaries are responsible for producing eggs and hormones like estrogen and progesterone. These hormones regulate the menstrual cycle and support pregnancy. The fallopian tubes transport eggs from the ovaries to the uterus and are typically where fertilization occurs. Now let's talk about what is considered not normal. Structural abnormalities or conditions that impair function can be concerning. Examples include congenital absence or malformation of reproductive organs, infections, tumors, cysts, or hormonal imbalances. Some individuals may be born intersex, with variations in reproductive anatomy that do not fit typical definitions of female or male. Medical conditions such as endometriosis, pelvic inflammatory disease, or prolapse also representing deviations from typical anatomy and function. Recognizing these issues is important for health and well-being. Many variations in appearance or minor symptoms do not require treatment. However, if you experience pain, abnormal bleeding, infertility, or noticeable structural changes, it is wise to consult a healthcare provider. Understanding the female reproductive system is essential for recognizing what is normal and what may require attention. This system is designed for protection, defense, and continuation of the species through reproduction. It showcases a natural diversity in form and function, with a range of normal appearances and changes throughout life.